Okay, so we're going to talk now about meds that affect the respiratory system. And again, we're talking about classes of medications. Any specific meds would be either identified as examples of those classes or they've been included in your notes as an example of that class. So adrenergic agonists, these are things like epinephrine or albuterol. They either stimulate or mimic the sympathetic nervous system, and they cause a fight or flight response. Beta-2 adrenergics dilate the bronchioles. So if you want to look at the full effects of the adrenergic meds, there's a whole chapter on it in your pharmacology book, and that will tell you about side effects. So if I'm stimulating the adrenergic response that says, let's constrict the vessels, raise the heart rate, open the lungs up, all of these other effects, it relaxes the intestine, relaxes the bladder, not the sphincter, the bladder. It relaxes the uterus. So I'm taking this med for my asthma to open up my airways. What are the side effects I'm going to experience? Well, I'm going to have increased heart rate. I'm going to feel jittery. I'm going to be ready to run and deal with the danger. I may have constipation, urinary retention. If I'm in labor, it may slow my labor down. We actually use that side effect sometimes in labor and delivery. So think about what those side effects would be. Okay. Now, side effects are dose related and they're related to specific receptors. Non-selective adrenergics actually have more side effects. Albuterol has been tweaked a little bit to leave albuterol, and it actually decreases some of the cardiac and jittery type side effects. So it tends to work more on the lungs and less on the other things. So there are fewer side effects. Patients who have asthma, we need to be really careful about non-selective beta blockers. Okay. Okay. Next section is expectorant. And when I want to talk about expectorant versus mucolytic. Expectorants pull water into the mucus to thin it. So this is something like guaifenesin. It's Mucinex or Robitussin, plain old-fashioned single ingredient Robitussin. I know Robitussin has mixes of 16 different things now, but plain old-fashioned single ingredient Robitussin was guaifenesin. Mucinex is guaifenesin. And what that does is pull water into the mucus to thin it out. What that means is it's not going to work if you don't drink enough water. So that's why it says on the package, take with a full glass of water. So the water is there to pull into that mucus. Once it's thinned, it's easier to cough up. Now, mucolytics actually break down the protein and liquefy the mucus. So this is something like acetylcysteine. Anybody know the other use of acetylcysteine? Acetylcysteine is used for acetaminophen overdose. It binds with acetaminophen for excretion. It's given either orally or intrally for that purpose. It would be, we want it to either orally or through an NG tube. Orally, it tastes and smells really, really nasty, and it has to be given frequently, but every 30 minutes for several hours. So if we're giving that to the 3-year-old that drank the bottle of strawberry flavored Tylenol liquid, it's really critical that we get that bound. So we're going to give that 3-year-old pretty much whatever we can get them to take that acetylcysteine with. I've seen it mixed with Coca-Cola with added sugar on top, like add more sugar into that mixture to try to cover the taste. Okay, next section we'll talk about is neurologic meds. Respiratory was short. We've got bronchodilators and we've got mucolytics. I do want to talk just a minute about other bronchodilators, and I'm not going to test over these, but the bronchodilators we talked about are the adrenergic agonists. There also are anticholinergics. So the parasympathetic nervous system does the opposite of the sympathetic. It slows everything back down to normal. Okay, that's the cholinergic system. If we block that, then we're opposing the cholinergic system. So that actually is going to have similar effects to an adrenergic agonist. Frequently, we give, how many of you have given or seen given ANA nebulizers? Frequently, we give an adrenergic agonist and an anticholinergic together. We give albuterol, and Atrovent is the trade name for ipratropium bromide. Okay. If we give those medications through inhalation instead of systemically, have the patient rinse and spit, it decreases the side effects as well. And then there are there are theophylline, caffeine, that class of meds, the methylxanthines. Those also have bronchodilator action, and they work by stimulating the sympathetic nervous system. Okay, next section, we'll talk about the neurologic system, and it's a little bit longer.